Hello there, and welcome to the first ever Raising the Roof podcast. I'm your host here at Yorkshire Housing, Nick Atkin, and this is the first episode in our first season of podcasts. We're looking at the topical issues that are having an impact on the housing world, but we're deliberately trying to think more widely than just housing. There are 6 more in this season, so keep an eye out for the details of the topics and who's taking part and the dates for those. And all of the podcasts will be available via your podcast provider platforms. As you can tell, I've been listening to the Peter Crouch podcast, so I've been nicking all his ideas in terms of the intros. So on to today, and what better way to kick off a new season than genuinely with 2 of my favourite people. Whose views, interestingly, I always listen to and learn from, but I never admit that to them until actually today. As we're emerging from lockdown today, we're looking at the things to watch out for, and particularly over the next few months, what might be in store for all of us, both in our home lives and also our work lives. So a very, very warm Yorkshire welcome to, first of all, to Andy Davies. Andy's the Chief Clinical Officer at both NHS Warrington and Halton CCGs, and also to Charlie Norman, who's the Chief Exec at Mosscare St Vincent. Just by way of a brief intro, because they're both very understated in what they do. So Andy's an award-winning GP, and by background, he's based in the Northwest, as is Charlie, but we're not going to hold that against them, even though this is a Yorkshire Housing podcast. Andy has been sort of overseeing and continuing to plan for the response to the pandemic across both Halton and Warrington. And interestingly, something you might not know about Andy is that romance blossomed for him, like life on the set of Casualty, when he was a junior doctor in his first hospital placement, where he met his wife, who was working there as a nurse. So there you go. We've actually got true life sort of Casualty romance with us today. Andy has been absolutely pivotal, I think, for many of us in his unique interpretation of COVID, really clearly explaining how the virus behaves and the impact it has in plain English terms. And here at Yorkshire Housing, we love people who just are straight talking. He's really what I would class as the Northwest and slightly more lively version of Professor Chris Whitty. So probably not an intro that Andy's ever been given before, but that's Andy. And I think it's fair to say that some of Andy's key headline stats and his messages have been a key influencing factor behind how both myself and I know many others in the housing sector have been able to keep both our colleagues and customers safe. So that's Andy. So over to Charlie. Charlie, as you've heard, is a big dog lover, and she's worked in housing for a few years. I won't tell you how many, but she's been based both in the Northwest and also prior to this, she was the groover in Vancouver. A big nod there to Brian Adams, Mrs. Atkin's favourite musician. And she'll be happy if she's listening, but that's very unlikely. She thinks most of the things I do are nonsense. So, but anyway, I'll give a nod anyway. In addition to the fab work that Charlie is delivering through MSV and what they're doing to create more homes that people can afford, they're also doing a huge amount in terms of improving life chances of the customers in their local communities, and also the opportunities. But in addition to that, and in addition to try and keep her dogs quiet as well, she's also a big volunteer in a local area, as well as being a board member on 2 national bodies. So goodness knows, I thought I took a lot of Barocca, but Charlie must really sort of be on wholesale amounts. Building on the Run for Homes a few years ago, when she learnt a whole new language with walking alongside John Lord, she's now looking to go it alone post-lockdown. And complete the Lake District 24 Peaks Challenge for Mind. So that's the intros over. That's the panel for today. So here we go. First, over to you, Andy. And I suppose just to an easy start, what's the latest on the virus?
Well, thanks, Nick. It's been a long road, hasn't it, getting here, sort of with coronavirus. It is still around, obviously, but the figures are looking a lot better, and partly that's because of everybody's efforts staying at home, doing the hands, face, space, and keeping windows open, which I think have landed really well. But certainly in terms of case rates, we're down to about 39 per 100,000. And if you remember when we started, we were getting worried if we went above 20 per 100,000. That was well, you need to think about whether you should be travelling. So we're getting back down to those levels, and excess mortality type data, and we'll perhaps touch on that a bit later, but excess mortality, so the number of people who've died this year compared to a similar period in previous years has dropped right down. Still slight excesses in some of the younger age groups, unfortunately, but the older age groups where the vaccine's been rolled out, that's now dropped below sort of the usual figures in terms of numbers of deaths and hospitalisations. I think we're just under 500 people in crit care in the country now, so that's a lot better than it was. So everything's going the right direction.
And you mentioned there about vaccination, Andy. Just one of the things I'm still trying to get my head around is how mass vaccination helps, because I suppose my understanding is that the evidence is still unclear as to whether you can still carry the virus, even though it might not affect you directly because you're vaccinated, or might not lead to more severe symptoms. So do you know where we're up to on that? Do you know what's the latest on that?
Yeah, so it's one of the things, isn't it? Do you get what we call sterilizing immunity? So it completely nukes the virus and stops it spreading, or does it just help with symptoms? I think we're on the side of it's a bit of both, really. We get sort of good symptom relief from it, so you get less severe disease and pretty much no hospitalisation with the current variants if you've got the vaccine on board, and particularly after the second dose, that effect's boosted for much longer and much more impactful. There's some indication that it reduces the viral load that you carry. So if you imagine, viruses can't copy themselves, they hijack host cells to make copies. So what happens is they come in, your cells will make lots and lots of viruses, they shed those out, and then they come out in droplets and aerosol, which then gets carried to somebody else. So if you imagine a cloud around yourself of virus particles when you're infectious, if you've had the vaccine, that cloud's a lot less dense and travels a lot less far because of that. So the risks of somebody actually getting a dose of the virus by being in proximity to somebody who's been vaccinated does go down. That's not been quantified, but there's an impact on transmission as well, even though we're not getting sterilising levels of immunity. And we've seen that because of the reducing case rates, even though we're unlocking some of the lockdown measures, we're still getting a reduction in the case rates. So that's positive, which is why the gateway tests are there to give time to say, well, if we start to open up this bit of what we do, what impact does that have on transmission? And so far, that downward slope has been maintained.
And I suppose that's great. And we've got over half the adult population now vaccinated, but we keep hearing about the third wave in Europe, and also we've seen the stats in Brazil where where sadly they've just hit the grim total of over 4,000 deaths per day. What do you think we need to be ready for? A third, a fourth, a fifth wave? Where do you see this going? Where's the end, I suppose? Because we keep being told to be cautious and things are getting better, but we're then also told that there's another wave that's going to hit, and there might be something else after that, and we're unclear about what's going to happen in the autumn, and we're told there might be winter lockdown. So what's your sense really, Andy? I know you've talked before about how the virus mutates, and that scares the living daylights out of me when you tell me how many mutations there actually are compared to the ones that get into the media. But I suppose where do you see this heading? Is it going to be like flu and mumps and measles and all those sorts of things, where it just becomes part of life to be immunized, or is this different?
So I think you have it right when you say it's probably something we're going to have to live with. So looking at it, they talk about endemic viruses, and most viruses that we have in society come from an animal reservoir at some point in the past, and they just stick around and they become an annual problem. Interestingly, this year we had much less incidents of flu over winter. We usually have a really heavy flu season in this country, and we've got a good vaccination program for that. But with the social distancing measures that were in place, we saw less flu as well. So there's some lessons there for managing general endemic sort of cyclical viruses that spread in similar ways. So I think with coronavirus, we'll get the immunity that we get from the vaccine. We'll have wild type immunity from people who've had it. It's unlikely that any individual set of mutations completely invalidate vaccines or natural immunity. They can sort of lessen it. It's not common that you get something which is called a complete escape. So the antibodies that you've got don't work. And why is that? Because if you think about viruses, they have to get in the cell somehow. So they have a key that fits a lock. And most of the antibodies that we're vaccinated against are most of the anneals, so the bits that the body needs to react to that we've presented, basically trigger antibodies to the key. So if you imagine a key and you get a load of blue tack and stick a load of blue tack all over the key, it ain't going to fit in the lock anymore. So it doesn't open the door. The other bit is if the virus mutates to try and escape all of those different antibodies, you change the shape of the key, so the key doesn't fit the door. So by doing what we've done and targeting the way the virus enters the cell, it really helps with that escape risk, because we've specifically targeted the bit that allows it to start the process of replication. So even though it might change and that might affect the what we call the efficacy of the vaccines, so you might get perhaps more significant disease or slightly more hospital admissions, it's not going to completely invalidate the work. So although we talk about, it's a bit like that big snake at the end of Snake and Ladders, that if you roll the long number, you're going all the way back to square one. I don't think we're going to hit that snake. That doesn't happen often.
Chris Whitty could learn loads from you, really could, Andy. In terms of, he needs to get Snakes and Ladders board up at that briefing session and just show us where it goes. And I think that is reassuring, because I think, the media in some ways have not helped some of the reporting, I think, on this, in terms of talking about the mutations. And I, certainly for me, I've spoken to some of my friends, and some are reluctant to have the vaccine, because they sort of say, well, I could have the vaccine and it'll mutate and I'll have to have another one. And so that's really, really helpful, I think. Do you think we will get a third wave? And if so, when do you think that'll hit?
So in the Northwest, we've kind of had a third wave already. We had the first wave way back when it started, sort of March, April time in 2020. We had sort of like a late summer wave, August, September, and then we had a really big peak, which peaked around about the 8th of January. And that was what we call a progressive peak. So it when you get two peaks that are consecutively high, what that means is you've got unchecked spread in community of a virus. So that was quite worrying, because that could have gone on. In terms of third, fourth, with the release from lockdown, although the vaccine's doing a good job, we haven't got to everybody yet. So there's likely to be more cases in the younger age groups, and certainly below the vaccinated age. We'll see more cases there, and there'll be a proportion of those who will become sick and need hospital through that. Will it be as severe as the other peaks? Hopefully not, because the most vulnerable people have been covered off. So we might see more case rates, but less conversion to hospital stays, less need for critical care, and obviously less mortality, which is really positive. That does allow the virus to spread more, and obviously if you spread a virus more, you make more copies. More of those copies produce mutations, which may or may not be beneficial in terms of spread. So having more virus around just in and of itself is never a good thing, because it gives it more opportunity to think about, well, it doesn't think because it's not really alive, but to mutate and exploit any niches that are left for spread. So it's worth keeping an eye on that, and that's why the phased rollout programs are really important. If you took everything off all at once, you just have still 50% of the population roughly that haven't been vaccinated, and only a couple of percentage of those will have any immunity at all. That's a lot of people that can start becoming virus factories to help build the next mutation, basically.
Yeah, I suppose that's a really good response also to those who say you should just let it rip through the community and then get herd immunity. It clearly sort of that sort of undermines some of that. And I know I saw Charlie's expression when you were talking about 2 peaks, and she was like thinking, 2 peaks, I'm doing 24 when I get out of lockdown. So, I think there's, I think, we perhaps need to put that into context. But biggest question of all, really, Andy, for you, before we move to Charlie, it's probably the one that most people listening to this will want to know. Will you and the wider population of the UK be holidaying abroad this summer?
Probably not, I'm going to say. Probably not. I think 2 reasons. One is we won't have enough people vaccinated that will want to go. And even if we do go, I think that just the overhead of doing it and the risk of bringing something back could be too high. If you look at what's going on around the world, we're lucky. We're sort of coming down off our worst peak. Other areas are going up their peak. So, and that'll take a good few months in terms of just the disease risk, but also the infrastructure. I mean, they're going to have businesses that will shut down, and it's how quickly can they come back on to support tourism and leisure. We're a good few months out and we've still not reopened and given Boris his irreversible pint. So that's coming apparently, and that's a few months down the line. And then you've got to think about, we're going to start ramping up for winter and all that comes there in a year with lots of unknowns this year. So I think infrastructure wise, we're going to be struggling for another 6-12 months, and probably have an impact to this for 2 years while we think about what is it we bring back on and how.
So Ryanair's advert earlier this year to jab and go was a bit presumptuous, was it?
Well, given their flights cost about 30-40 quid if you're going somewhere fairly close each way, and it's going to cost about 200 quid for a PCR when you get back, it might put people off.
You're right. Well, you heard it here first. Book your staycation now. They're only going to go up in price.
Definitely.
I can feel the whole of the UK tilting to the southwest as everybody goes to Devon and Cornwall for this summer. Yeah. So thanks, Andy. Charlie, sorry, we're going to come to you now. I suppose, given what you've heard from Andy there, and from what we know from our previous conversations with Andy, what does all this mean for you, and also personally, also for MSV? How's all this pan out for you?
Nick, and it's always fascinating to listen to Andy, isn't it? And probably nobody's listening now because everybody's gone off to book the staycation. So yeah, firstly for me as a person, this has been a very scary, humbling time, hasn't it? And as a mum, I guess I've been really worried, and as a leader, I've been really worried about everything. And like everybody in our sector, I think we've done an absolutely brilliant job, trying to respond to this unprecedented. I know that that word's used massively, but none of us had this on our strategic risk registers, did we? Or had thought about this, or put mitigation plans in place for a worldwide pandemic. So I think for me, I'm definitely not booking a holiday, and I'm definitely not going back in a mosh pit anytime soon when the gigs start to resume. And I'm just glad to have had my first jab, and my daughter's had her first jab because she's got an underlying health condition, and I've been really worried about her. And my focus is very much on keeping everybody in my family safe, and also the business of an MSV and its communities safe. So I think, the pandemic collided with 10 years of austerity, with a housing crisis, with a climate crisis, with massive issues facing people in terms of social care and health issues. And all of that, I mean, we can't forget what came before this, and the way we've sort of messed with the planet has led to this as well, in my view. And I know Andy's got a similar view. And I think we've got a big job to do. I think we've responded really well, and what MSV has done, like most organisations, we've reset our sort of corporate strategy for the next couple of years. We were already working on something themed around people, planet, and place, and that people, planet, and place thing has really come to life for us, because this, at the end of the day, we are about people, aren't we? And we're about our customers and the support that we've given to people in our communities, and how we help people to recover from this. Planet was already central to our strategy, and that sustainability thing around what do we do to reduce carbon emissions, but also fuel poverty and people living in a decent warm home. and the skills that people need to do that work, and reducing bills, so like that skills and bills thing, and then the place and the home that we have has just been brought into massive sharp focus, hasn't it? You know, we've all been looking at where we live and how we use our home and whether it's suitable and pandemic proof, I guess, for the future. But also, you know, if people have been living in cramped, overcrowded housing conditions, or unhealthy living conditions, or have been feeling unsafe, or have no green space or no air quality and all those things, I think we've got to take a good hard look at some of the sort of regeneration needs and some of the way that we're building houses in the future as well. So I think there's a lot on that people, planet and place thing, and the people side of things is about how we've managed as a business and how we've supported our colleagues, because everybody's been through a trauma, haven't they? This has been a traumatic experience for everybody and for our communities. And I think talking to some teams and neighbourhood officers and people like that during the last 12, 14, 15 months, however long it's been so long, people have said to me that they've got to know their customers more during this time. Even though people have been working from home, they've been really getting into the detail of what people need and the support that they've needed. Some people have just been really happy to go with, like, you know, digitalisation and more transactional stuff online and that kind of thing. And some people have needed more support. So we're really sort of focusing on that and accelerating some of our plans of being digital with a heart is how we describe it. So, and then the people, planet and place corporate plan has got 3 phases, and the phases were recovery, and we're in that recovery sort of phase now, aren't we? Although we keep going in and out of it, and I think things are uncertain, aren't they, still, as Andy said. And the reimagining phase of, like, you know, how do we reshape our services? How do we work in the future with working on something called flexible futures? And resilience and building resilience. The resilience word is key, isn't it? You know, we didn't have very good resilience going into this, and we need to use our platform, I think, as community anchors and organisations that work with communities to actually help people to build resilience. And I think the thing that has come to light more than ever before for us is that the word kindness. And we talk about kindness, and we have 2 sort of mantras within MSV. One's about do the decent thing. If you do the decent thing in all your dealings, then you can't really argue with that, can you? The next phase of the pandemic is like a contagion of kindness, as opposed to the pandemic we've been talking about. That would be wonderful. So we're clinging on to that, being kind to each other and being kind to our communities. So that's what it's meant for us. I mean, there's loads within that, and you know, I think we've got to use this to sort of tackle those big systemic issues that we had before around overcrowding, around inequalities, and COVID sort of traced the entrenched lines of inequality, hasn't it? So, and the climate crisis and the housing crisis. So we need more homes, we need better homes, we need better opportunities for people. And I'm on like a rampage at the moment about young people and how we support young people to recover from this, because it's been massive. I mean, it's been massive for everybody, hasn't it? But, you know, accessing jobs, people who've had missed education, what are the aspirations and ambitions for people in the future, this generation of young people and future generations. And we're doing loads of work in partnership in Greater Manchester to look at that, how we can play our part and be helpful with that. So there's not much to do, Nick, as you know. But, you know, I feel really driven to sort of try and recover really well from this and a better normal in future.
Yeah, and I think some real sort of key messages out of that. I mean, I wrote down 6 things then, you know, like I love that people, planet and place. I thought skills and bills was a great way of sort of describing what, you know, the role that housing associations can and the difference it can make. Digital with a heart was just music to my ears. I thought the flexible futures again, and do the decent thing. But I have to say, a contagion of kindness. You know, going into the first lockdown, I think I saw like many of us, I saw a huge difference in terms of people and how they were with each other. You know, I spoke to some of my neighbours. I've lived here 15 years, and I'm embarrassed. I'd never spoken to some of them, And we actually were, we were all dancing on our doorsteps every Sunday night, and there was a real sort of sense of coming together. And so I think, some of that continuing that bonding that we've had as humans, I think is really key. Charlie, one of the things I just wanted to touch on with you, because you've talked about some of the things that you're doing, which are great and don't surprise me at all. But I think one of the things that's been slightly hidden away, although it did come up last summer because of the Black Lives Matter movement. But I think you working with some of the most culturally diverse communities probably in the country. Can you just give us a sense of how they've been affected disproportionately from the impacts of COVID, but in terms of whether that's socially, economically, what have you seen, and just paint if you could just in a couple of minutes paint a picture of how you've seen that be disproportionately different in its impact.
Well, I think it's been a huge wake-up call, and I think a lot of us were talking about racial inequality before and about inequality generally, and as I said, the COVID seems to have just tracked that sort of those lines of inequality, doesn't it, in society, and we've seen that firsthand. I mean, unbelievably, we've had a lot of deaths in some of the areas that we work in. Some of our really sort of loved customers and community champions have sadly passed away. And we've seen lots of sort of trauma with young people in some of the areas that we work, because we work with a lot of younger disadvantaged people, and we work in some sort of areas where I think that we've got sort of 57 languages spoken in one of our areas, and massively diverse communities, and that's something we celebrate and something we're positive about, and so I think we've got to sort of like hang on to that, sort of celebrating the diversity and not sort of talking it down, but also a good hard look at the reality of what we're dealing with, and this whole sort of notion of levelling up and dealing with inequality and all of this. I think we've got a moment here, and I can feel it and see it and it's just palpable. So for example, in Mosscare, one of the areas that we work in, that people are actually starting to call things out now, and we've set up I didn't do it, it was some really driven people within our organisation set up an anti-racism task force, and just a sort of movement within the business, if you like, and sort of a call to arms to get people together to share in a safe space their experiences of everyday racism and things that people have experienced, and how people feel that this pandemic has hit certain groups unfairly. And I think it has, those with underlying health conditions. We're working with an organisation called CARN on the vaccine programme as well, and making sure we get out there and reach out to people to make sure that people are taking the vaccine, because there is a lot of scepticism, there's a lot within certain communities, and so I think more than anything it's just been a real focus for us that we are lucky enough to work within those very, very diverse communities. And so what we've got to do is be part of that call to sort of more funding, more understanding, more cultural appropriateness about the way that we work. And it's been a moment, I think the George Floyd tragedy and all the ones that went before that, and the Black Lives Matter movement and the anti-racism forum that we've got in the business. We've set up a new LGBTQ+ forum as well. And so we really sort of, we're going through an Investors in Diversity programme at the moment. And I think we've still got a long way to go, even though I think we do very well in that sort of area. I think we've got a long way to go. We've got to learn from each other to understand that some people have been put at more risk because they're in lower paid jobs. They're potentially living in overcrowded circumstances. The people who've been going out doing the bus driving and the cleaning and working in hospitals and in frontline services every day, putting themselves at more risk. And we just need to value people more. So I just think it's been a huge wake-up call, as I said, and it's just put a bit of fire in our belly to do even more than we did before. So.
Yeah, no, that's great. Thanks, Charlie. And I suppose it's it's a real wake-up call for us all when somebody like yourself, who certainly for me, I look at the work that you and MSV are doing as really sort of leading the way on this, and for you to say that there's still a huge amount more that you need to do really does bring it into sharp focus, just the challenge for all of us. Because you're right, I think the one thing that this pandemic has done has exacerbated or widened the inequalities that were already there. In many cases were hidden away, and as housing associations, we probably see more of that than most other parts of society. But I think, yeah, certainly there's a big wake-up call there for us. So thanks for that. I suppose I just want to sort of move on a little bit in terms of trying to plan ahead for what's coming. So at the moment, we've been told work from home if you can, but there are now some messages starting to emerge out of government, which I think one of the funniest ones I heard was those people who've been working from home have had enough time off now, and they need to get back into the office and start doing some work, which I thought was probably not the best message I've heard from government. Putting that to one side, Andy, I think one of the things that really, really helped inform, I know, my approach to keeping people safe was in the early days of the pandemic, when you shared very clearly and very eloquently the risk of transmission in an indoor environment, and particularly in an office with air conditioning and air that's recirculated. And I know we've done a lot in terms of social distancing and making the workplace more COVID safe. But COVID, as you say, we're going to learn to live with it, and life will move on. Where do you think, both of you really, so whichever one of you wants to jump in first, where do you think all this fits? Charlie, you talked about opportunity. Do you think there's an opportunity here in terms of how we work in the future? And if so, how will you and how will your colleagues be working in the future?
Do you want me to answer that, or Andy?
Either, whoever wants. You've got the mic, so you go first, okay, Charlie, and then I'll come to Andy.
I think we just all need a less traditional mindset on this stuff, don't we? So I think there are big opportunities. I think some of the big strategies we've got going forward, like that sustainability zero carbon strategy, that's going to help us create job opportunities, isn't it? And I'm a sort of glass 3/4 full type person, and rather than half full or half empty. Sometimes it has been empty in the last 15 months. It's been a strange time. But I think for MSV, we were already on the trajectory. I can never say that word. We were already going agile, and because of our geography and the way we work. So I think we've been in an extreme situation, haven't we? We've had colleagues on the front line who've been going day in, day out to schemes to support people, operatives going into people's homes, putting themselves at risk, and really grateful to them. And then those of us who've been working at home, and we're actually working from home. It's outrageous. So we've been on holiday. It's all been very extreme, hasn't it? So what we don't want to do is go back from this extreme to another extreme, which was busy, frazzled, commuting lives that we had before, which was no good for any of us. So I think it's going to be all about balance. And we've, as I said before, we've talked about flexible futures. We're engaging with our whole workforce at the moment, and I do subscribe to your sort of anytime, anywhere thing about the way that you work, Nick. I think it is absolutely right. Can't be for everybody, because you've got people who have to put to be within schemes in certain times and things like that. But even that can offer flexibility. But I think people need people. So what we're doing is going with collaboration spaces. So when you do need to be with people for a project, so you've got new people, need to spark off others, then we'll have collaboration spaces. But the concept of the office and the 9 to 5 and all of that, I mean, it's kind of 90s, not even like noughties, is it? So and so that flexible futures offer for us will be about if you've got really critical pieces of work to do, just stay at home to do them. Everybody's set up, we can do that, and then offer a blended approach for the way that everybody work, collaboration space, or working at home, or out in the community, going for a walk with somebody, having a coffee, whatever it is you need to do. Just get the job done, and we'll trust you to do it.
That's great. Thanks, Charlie. And you've nicely teed me up for one of our future podcasts, which is the Martini principle of the future of work, anytime, any place, anywhere. So thanks for that. We're just cantering into the last 5 minutes. I've got a quick fire round which I didn't warn you about in advance. So, but there is a quick fire question round coming up. But Andy, same thing to you. How's this? What's this going to look like for you, and how the NHS and particularly the CCGs that you oversee will be operating?
CCGs are going to be different, aren't they? They're not going to be here. So, yeah, ICS are going to be the thing. So I think what healthcare provision, there's been massive leaps and bounds, use technology to help people access care. I think there's a balance, isn't there, between the human contact that's essential in building trust, confidence and understanding around sort of fairly challenging times in people's lives a lot of the times. And at the lowest level, somebody's presentation to a healthcare sort of professional is because they're worried about something that they can't explain. And sometimes there's a perfectly reasonable, ordinary explanation, and sometimes you have to do more, and it might lead to, some diagnosis and treatment that can be quite scary at times. So I think we've got to get that balance right. Technology can certainly help us with planning of care and making sure we've got the right care in the right place at the right time. It's not quite the Martini principle, but that's what we use. Although Martini will go a long way sometimes, the getting that sort of built better is right. And I think sort of Charlie touched on some of the other things broader in society that around, coronavirus has exploited a niche in our community, hasn't it? And if you look in 1975, the world had 4 billion people. It's just about 8 billion now. Wow. So, and for most of our time on this planet as a species, we've had less than 1 billion people by far and away the most time. So we're in a new set of circumstances where there's enough human beings on the planet that we actually affect the planet, and that's never been the case really for the vast majority of the billions and millions of years that the planet's been around. And things that we're doing like urbanisation, working in offices, working in cities, packing in offices and working out what's the maximum number of people you can pack in by square metre and give them enough air to breathe. That's not perhaps the best strategy going forward. And when you look at things like coronavirus, it's exploiting that niche, and our major outbreaks were going down until about 2010. They've started to go up. So we've got something about the way that we live that we need to change, and all of those practical things that we can do to build in a bit of a firewall in those chains of infection through our society is really important.
Right, okay, and that fits perfectly with Charlie's summary before of people, planet and place, and as ever, Andy, some killer stats in there that just make you go, what, have I heard that right? So thanks for that. Right, so we're entering the last 2 minutes, so it's a quick fire round now. So I literally sort of I'll give you some multi choices or ask for a short answer. First one, I've got 3 syringes in my hand and you haven't had a jab yet. Moderna, Pfizer or AstraZeneca, which one do you go for? Charlie, you first.
Any of them, because I trust the science.
Oh. Andy?
Well, I've ended up having AstraZeneca. I didn't express a choice, and I'd agree. Both much for muchness, different routes to the same outcome.
Okay, great. You should both be politicians. Great political answers. So, second thing, you're both board members of other organisations. What one top tip would you give for your board members, any board members listening, as we come out of the pandemic? What is it they need to be doing to support their organisation in less than 10 seconds? Andy?
Be kind to people, treat them well, and get more people, work them less hard.
Fantastic. And I suppose that's advice for me as well. So, Charlie, over to you.
Completely agree with that. I'll stick on the contagion of kindness theme. I think we are about people, aren't we? And just treat people well and treat people kindly and with respect, and everything else should flow from that. And just one more thing, I think longer term thinking, because we live in a short term world, don't we? And I think now more than ever we need to sort of think longer term as we respond to crises and things. Keep thinking longer term about the impact you have now on this generation and future generations, and being a good ambassador. I don't know if people have read that book, but it's fantastic. Being a good ancestor.
We'll put a link at the bottom of the link to this podcast. So thanks for that, Charlie. So final one from me. What's the single biggest learning point you've taken from the last 12 months? Charlie?
Not to take anything for granted, including, everything in your life, that like enjoy the little things. that kindness thing, be kind to people, and just make sure that you're ready for anything that can happen, because life is so uncertain.
Absolutely. And I love the way you don't follow the rules as well. 4 things for the price of 1. Great, Charlie. Love it. That's what I love about you. Andy, same to you, and then we're going to wrap up.
Be adaptive.
Be adaptive. Okay, that's great. Andy, Charlie, thank you so much. I couldn't think of a better way to kickstart this podcast series. And as ever, you haven't let us down. It's been fantastic. I can't believe that's 40 minutes up. Jade, who's doing the controlling here, she's scowling at me to finish because she knows I want to continue. But a massive thank you for kickstarting the process. It's been a great conversation. Absolutely loved every minute of it. And for everybody listening, that's all we've got time for today. So thanks for listening. The next episode, as Charlie and Andy have beautifully lined me up to remind you, is the Martini Principle. You can find that, this, and all other episodes wherever you find your usual podcasts. My name's Nick Atkin from Yorkshire Housing. Thanks very much for listening. Until the next time, stay safe, stay well. Thank you.